9 early signs of skin cancer you must not ignore. Skin cancer is sneaky. It shows up silently. No pain, no bother. And by the time you realize it, it might already be way more advanced than you think. And the scariest part? The signs are right there, right in front of you, on your skin, every day. The problem is that, most of the time, people just don't know how to spot them. They ignore them, think it's nothing serious, believe it will go away on its own, until it turns into something way more serious. There are tiny signs, almost invisible, that your body starts to give. And understanding these signs can literally be the difference between a long, healthy life or facing a battle that could have been avoided. Imagine something seemingly simple, something you see in the mirror every day. Could be a silent warning that something really wrong is happening inside your body. Details on your skin, little changes that, if you know how to watch for them, could be your best chance to act in time. And there's more. Among all these signs, there's one considered the sneakiest of all, the most dangerous, the one that, if you ignore it, the consequences can be devastating. Are you really sure you know how to recognize the signs your own body is giving you? Stay sharp, because what you're about to find out here could change your life forever. Number 9. Dark spots that appear suddenly. Imagine waking up, looking at your hands or feet, and noticing a dark spot that was never there before. That might seem like just a detail, but actually, it's one of the most worrying and dangerous signs when talking about skin cancer, especially melanoma. Dark spots appearing in less common places like palms, soles, nails, or even mucous membranes like mouth and genitals should never be ignored. These are areas people often don't even think to check, which leads to late diagnosis and, therefore, higher danger. It's important to understand that melanoma, the most aggressive type of skin cancer, doesn't just show up in sun-exposed areas. On the contrary, these spots can appear exactly where the sun rarely hits, making this sign even trickier. A dark, irregular spot that pops up out of nowhere, with colors ranging from brown to black, or even bluish or grayish tones, is an urgent reason to get a medical checkup. And when we talk about nails, for example, it can show as a dark line crossing the nail, often mistaken for a simple bruise. Have you checked your palms, soles, and nails today? Besides these areas, suspicious spots can also appear on mucous membranes inside the mouth, nose, genitals, and even the anus. That's why dermatologists always stress the importance of a full skin exam, including these spots. After all, when cancer appears in these spots, it tends to be more aggressive, progressing fast and posing a much bigger health risk. If you notice a dark spot suddenly showing up with no explanation, it's time to act, especially if it has features like rapid growth, very dark color, irregular edges, or is accompanied by other signs like itching, pain, or bleeding. Ignoring this warning could have very serious consequences for your health. And it doesn't matter if you've never had a family history of cancer or if your skin is darker. Everyone is at risk, although people with darker skin tend to get melanomas exactly in these less common spots. So, making it a habit to regularly check these body parts is a simple step that could save your life. When it comes to skin cancer, time is critical. The sooner you spot a suspicious change, the better the chances for effective treatment and cure. So, if you notice something strange, don't wait. See a dermatologist right away and get the necessary exams done. Taking care of your skin is definitely taking care of your life. Number 8. Red or pink patches that peel. Have you noticed a red or pink patch on your skin that started peeling for no clear reason? This is one of the most common signs of some types of skin cancer, mainly basal cell carcinoma and squamous cell carcinoma. These lesions usually appear on areas heavily exposed to the sun, like the face, neck, ears, arms, and hands, and are often mistaken for allergies, dermatitis, or just simple irritations that come and go. But watch out, that confusion can cost you big time. These patches might start small, subtle, with a rough texture, like dry skin or a scab that never fully goes away. However, over time, they may grow, become raised, increase peeling, or even show wounds that won't heal. And the sneakiest part is that these lesions often don't hurt or bother you. So many people delay getting medical help. Another thing to watch for is that these patches can change in appearance over time. They might get thicker, develop a persistent crust, or even turn a deeper red or pink. It's also common for the edges to be slightly raised and the center lighter, giving an appearance often mistaken for an old wound or a harmless sunspot. If you notice a patch like this, especially in a sun-exposed area, and it doesn't go away after a few weeks, raise your red flag. Even if there's no pain or itching, this might be an early cancer lesion and should be checked by a dermatologist ASAP. The earlier the diagnosis, the higher the chances of a simple and effective treatment, sometimes even without surgery. And here's a crucial heads up. Although this is a very common sign, there's another sign considered the most dangerous of all, which you absolutely cannot ignore. That sign will be revealed in the last chapter of this video, so stay tuned until then. Number 7. Pain, burning, or sensitivity without reason. You know that annoying feeling of pain, burning, or strange sensitivity in a specific spot on your skin that seems normal. Well, that can also be an early sign of skin cancer. The worst part is, often that pain shows up with no visible injury, no obvious lesion to explain the discomfort. It's like, out of nowhere, that skin area starts acting weird. This kind of symptom is more common than you think, especially in developing lesions. The skin tissue starts suffering internal changes affecting nerve endings in the area, causing pain, burning, or even heightened sensitivity to touch. That's why many people ignore the sign, thinking it might be just a temporary irritation, an insect bite, or a mild allergy. The problem is that this discomfort doesn't go away. It tends to persist or even get worse over time. Sometimes the skin feels more sensitive to heat, cold, or friction from clothes, and that becomes constant. That's when many realize something's wrong, especially when the pain happens always in the same spot, with no clear reason. In some cases, the pain may be linked to a visible lesion like a spot, mole, or little wound that won't heal. In others, it might be the first sign, even before any visible change in the skin. This is more common in some types of skin cancer, like squamous cell carcinoma, which can cause local inflammation, pain, and discomfort. So if you feel a part of your skin is strange, sore, burning, or sensitive for no reason, don't ignore it. This might be an early sign of something way more serious. See a dermatologist and get it checked. When it comes to skin cancer, every bit of caution counts and time is precious. Number 6. Change in skin texture on a spot or mole. Now imagine that, all of a sudden, you notice the texture of your skin changed at a certain spot. That mole, patch, or skin area that was always smooth and normal suddenly starts to feel rough, scaly, hardened, or even raised. This kind of change often goes unnoticed, especially because it doesn't hurt and might not grab your attention at first. But know this, it's a super important sign and needs careful watching. When the skin texture changes locally, it indicates that something abnormal is happening in the deeper layers. It might be the start of uncontrolled cell growth, typical in skin cancers. Hardened areas that look like thick scabs or that become rough and flaky are clear warnings that spot needs urgent evaluation. Besides roughness, these areas often get raised, creating a bump on the skin, like a small plaque, nodule, or persistent crust. This is often seen in squamous cell carcinoma, a type of skin cancer that can evolve more aggressively if not treated early. Another important detail, these texture changes often come with color changes, with the skin turning redder, brownish, or even darker tones. And like other signs, this usually won't go away by itself. It tends to get worse if not medically treated. So, if you notice a spot on your skin getting different, thicker, rougher, harder, or with any strange bump, don't hesitate. See a dermatologist. This step could literally save your life. And heads up, although this is a very worrying sign, there's an even more serious, one you should never ignore. It will be revealed in the last chapter, so stay with this video till the end. Number 5. Moles with irregular or asymmetrical edges. Have you ever checked if your moles have a symmetrical shape? Know that this is one of the first things dermatologists look at when assessing skin cancer risk. A healthy mole usually has a round or oval shape with well-defined edges. On the other hand, a mole with irregular, jagged, blurry, or asymmetrical edges can be a very serious warning sign. Asymmetry means if you split the mole in two parts, they won't look alike. Also, the edges might look frayed, as if spreading in a messy way, without a regular outline. These traits are common in melanomas, the most aggressive type of skin cancer, which can grow quickly and spread to other organs if not caught early. Another detail worth attention is that suspicious moles don't just have irregular edges, but often show different colors inside the same lesion. You might see darker areas, almost black, mixed with shades of brown, red, or even bluish. This color variation, combined with strange edges, is a classic sign that must never be ignored. If you look closely at a mole and see it looks poorly shaped, with weird ends that are not clearly defined and seem to spread chaotically, that's enough reason to see a dermatologist immediately. These signs mean there are changes in your skin cells that could be malignant. And here's an essential reminder. Although this sign is very worrying, there's another even more alarming one, considered the most dangerous of all, that will be revealed in the last chapter of this video. So keep watching, because it could make all the difference in your life. Number 4. Persistent itching on moles or patches. Who hasn't felt sudden itching on their skin, right? But when that itching happens persistently, always in the same spot, especially on a mole or patch, that's a red flag. This is not normal and may indicate a cellular transformation process happening right there. Itching happens because, during the development of cancer cells, there's local inflammation stimulating skin nerve endings, causing discomfort. The scariest part is that this itching often comes with other signs, like mild redness, peeling, or small wounds that appear and disappear, never fully healing. Another thing to watch for is that the itching doesn't get better with moisturizers, creams, or common ointments. It keeps coming back every day, especially at night or after bathing when the skin is more sensitive. The biggest mistake people make is thinking it's just an allergy or mild irritation, delaying the search for a specialist. If this itching comes right from a mole or patch that was previously stable, that's even more serious. It might even be the first symptom before any visible change. This makes spotting this sign more challenging, but also more vital for early diagnosis. So don't underestimate itching that insists on staying in the same place, especially if it comes with skin changes. It's crucial to get a medical evaluation. And get ready, because the most dangerous sign, the one you must never, ever ignore, will be revealed in the last chapter. Number 3. Bleeding or scab formation on moles or patches. Imagine noticing that suddenly a mole, patch, or even a small skin lesion starts bleeding for no reason, or it develops a scab, which falls off but soon comes back, repeating like a wound that never fully heals. Know that this is one of the clearest warning signs for skin cancer. Spontaneous bleeding or bleeding from very minor trauma, like rubbing with a towel or light scratching, is not normal behavior for a mole or patch. This happens because cancer cells invade deeper skin layers, affecting blood vessels in the area. Also, the constant scab formation is a result of ongoing inflammation, indicating a lesion that won't heal because cells are multiplying in a disorganized way. This kind of sign is very common in squamous cell carcinomas and more advanced melanomas. Many people delay getting help because they think it's just a simple wound that will heal soon or irritation caused by clothing friction or small scratches. And that's exactly where the danger lies. If you notice any skin lesion bleeding often, even with minimal stimuli, or that always has a scab that won't go away, don't make the mistake of thinking it's something simple. This could be your body screaming for help, showing that something very serious is happening. And here's a serious warning. Even though this sign is very serious, the most dangerous one is still to come. It will be revealed in the last chapter, and it could truly be the difference between an early diagnosis or advanced disease. Number 2. Wounds that don't heal. You know that little wound that seems harmless, that you swear will heal but never fully does. That's one of the most classic and dangerous signs of skin cancer. Wounds that persist for more than 4 weeks with no improvement need full attention. It doesn't matter if it looks small, superficial, or if it closes and opens again. This means your body is trying to get rid of something it can't fight on its own. These wounds usually appear in sun-exposed areas like face, scalp, neck, arms, and legs, but they can also show up elsewhere. At first, they might look like a pimple, a little red bump, a skin crack, or even peeling. And that's why many ignore them, thinking it's a simple injury caused by a scratch, insect bite, or small cut. The problem is when that wound doesn't heal. It might shrink temporarily but reopens, starts bothering, forms crusts, or even bleeds. This happens because abnormal cells multiply uncontrollably there, stopping natural skin repair. It's like the body can't finish the healing process. These wounds are very common in basal cell and squamous cell carcinomas, but can also be linked to more aggressive melanomas. Ignoring this sign gives the disease time to advance, deepen, and in worse cases, spread to other organs. So if you have a wound that just won't heal, don't wait any longer. See a dermatologist immediately and get evaluated. Early diagnosis is what separates a simple treatment from a much more complicated situation. And now get ready, because it's time to find out the most dangerous sign of all, the one you absolutely must never ignore. Number 1. Spots or moles that change size, shape, or color. If there's one sign you should take extremely seriously, it's this one. A spot or mole that changes size, shape, or color cannot, under any circumstances, be ignored. These changes are often the first and most obvious sign that something's wrong with your skin cells. It's like your own body is giving you a clear warning that area needs urgent attention. When a mole starts growing fast, or it gets darker, lighter, shows different shades like brown, black, blue, red, or even whitish, that's not normal. Same goes for spots that develop irregular edges, become asymmetrical, or that were small but suddenly grow a lot. All this points to a very high risk of melanoma, the most aggressive and deadly skin cancer. Another detail you must never ignore is the fast progression. Sometimes, in just weeks or months, that mole that was there for years changes completely. That's no ordinary sign. It's your body screaming for help. Melanoma, unlike other skin cancers, has a very high capacity to metastasize, meaning it can spread to other organs like lungs, liver, and even brain. That's why regularly checking your own skin is one of the most powerful habits you can have in life. And if you notice any change, see a dermatologist immediately. Don't wait for things to get worse before taking action. And now that you know the 9 most important signs you can't ignore at all, it's time to understand what you can do starting today to prevent skin cancer. Yes, there are simple but super effective steps that can protect your health and ensure a much safer, calmer life. Let's talk about that next. Care 1. Use sunscreen every day. If there's one habit that should be mandatory for everyone, it's daily sunscreen use. And it doesn't matter if it's sunny, cloudy, if you're going to the beach, or just walking down the street. Sunscreen needs to be part of your routine. No excuses. That's because ultraviolet rays that damage the skin and cause cancer can pass through clouds, car windows, house windows, and reach you even without direct sun. Ideally, use sunscreen with SPF 30 or higher. And don't just slap it on. You need to spread it well on all exposed areas like face, ears, neck, chest, hands, and arms. And if you're outdoors, remember feet, legs, and any uncovered spots. Another essential point is reapplying. Many people put sunscreen on in the morning and think they're protected all day. That's a big mistake. Sunscreen must be reapplied every 2 hours, or anytime you sweat a lot. Get in water or dry off with a towel. Otherwise, your skin will be vulnerable again without you even noticing. Besides protecting against skin cancer, daily sunscreen use also prevents spots, wrinkles, premature aging, and even worse problems like sunburns. Your skin just wasn't made to get constant direct sun exposure. So if you don't have this habit yet, start today. Always carry a sunscreen bottle in your bag, backpack, car, or work drawer. And teach this to those you love, because this simple act can literally save lives. Care 2. Avoid sun exposure during peak hours. Did you know there's a time when the sun is up to 10 times more harmful to your skin? Yep, between 10 a.m. and 4 p.m. Ultraviolet rays are at their strongest. That means during this time, the risk of burns, premature aging, and of course, skin cancer shoots way up. Lots of people still believe sun at that time makes your skin look better. Or Just a few minutes won't hurt. In reality, that's one of the biggest skin health mistakes you can make. Sun rays then penetrate deep into the skin layers, damaging DNA and massively raising cancer risk. So the advice is clear: avoid sun exposure as much as possible during these hours. And if you can't, because of work, fun, or commitments, double down on protection. Wear wide brim hats, UV protected sunglasses, sun protective clothing, and of course, lots of sunscreen, applied regularly. Another good tactic is to seek shade whenever you can. Walk on the shady side of the street. Use umbrellas, tents, or any structure that shields your skin from direct sun. These simple actions can make a huge difference long term. Taking care of your skin doesn't mean hiding from the sun, but knowing how to expose yourself smartly, during safer hours, and with full protection. It's a choice that shows self-love, self-care, and above all, responsibility for your health. Care 3. Do skin self-exams regularly. Do you do regular skin self-exams? If not, it's time to make it a habit. Checking your own body regularly is one of the simplest and most powerful ways to catch suspicious signs early that might indicate developing skin cancer. Ideally, do this self-exam once a month. And don't just check what's easy or visible in the mirror. You gotta look all over: scalp, behind ears, inside ears, armpits, groin, back of knees, soles of feet, palms of hands, nails, and even between fingers and toes. Ask someone you trust to help with hard-to-see places like your back and scalp. During the exam, look for moles, spots, or wounds that are changing size, shape, color, or that itch, burn, bleed, or just won't heal. Any new or weird change needs a dermatologist's look ASAP. Another key thing is to get familiar with your own skin's normal features. Know what spots you already have, their normal size, and where they are. This helps you notice when something new appears or something starts changing. Self-exams don't replace regular dermatologist visits, but are essential for early detection. And with skin cancer, the earlier you spot a problem, the higher the chance of cure, often with simple procedures and little hassle. So how about blocking some time once a month to care for yourself and your health? Your future self will thank you big time. And to keep getting the best videos for your health and well-being, subscribe to the channel. It exists for a very simple reason: to help you become a stronger and happier person. And in the video popping up on your screen right now, I reveal one leaf that destroys diabetes, bad cholesterol, fat, and cleans your arteries. To watch that video, just click on the screen. See you in the next video.